Hey everyone, this is Kelly with Sarasota Public Health and the Stride Wellness Committee, and welcome to today's Lunch and Learn. I'm actually going to be sharing with you a recording. I ended up having to be two places at once today with another meeting on top of this one, so a big thank you to my colleague Betty Cronus for helping me with the Lunch and Learn today. So she'll be accepting questions at the end to jot down and then share with me, and I'll get back to you, or you put them in the chat or vocalize them. Bob Pishik with the auditor's office will also be a good contact if you have questions about the benefits or this particular app as well. And he can connect you with Wellmark or Kingston, our health broker, to get you more information if you've got specific questions about coverage and stuff like that. But the Stride Wellness Committee this year has decided to do a series of various health benefit overviews. And the first one up today is Doctor on Demand. This is a telehealth program that is covered by our Wellmark benefits. So we just wanted to make sure that all employees were aware of this benefit and could take advantage of it when it's convenient and helpful to you. For those of you who are unfamiliar with telehealth programs, I'm going to show a quick clip just to kind of give you an overview of what telehealth programs out there look like. There are lots of different options. Today, we're just going to focus on Doctor in Demand, but there are several telehealth apps out there. And this gives you a little overview of what to expect from them.
Work, running errands, meeting up with friends, kids' football games. Life's busy and scheduling a doctor appointment can be tricky. That's where virtual visits come in. See a board-certified doctor or therapist via your smartphone, tablet, or computer. They can treat hundreds of medical issues, including 18 of the top 20 seen by urgent care and the ER. It's really that easy.
Okay, so really that easy. The Doctor on Demand app is convenient, it's cost efficient. You're able to see a doctor, even mental health professionals like psychologists, counselors, therapists as well with this act. The nice thing about the app is that you get to use it whenever you want, wherever you are. So it's available 24/7 from whatever location you're at pretty much. So telehealth really started to come on the market probably the last 5 years or so. And one of the reasons was trying to figure out a way to better contain healthcare costs. Last year, Americans alone spent $2.5 trillion on healthcare. That rounds out to about $8,000 a person. Now, obviously, most of us are on the short end of that amount, but there are people that are far above that amount too. And so $8,000 per person is certainly not something that a nation can sustain long term when that trend keeps going upwards. So continuing to look for different and alternative and cost-effective ways to offer healthcare to consumers across America. Another threat that was putting a pinch on our healthcare system was the increase in emergency department visits. Part of this is due to the shortage of providers in our area, and when you need to be seen and you can't get into your provider for several weeks, you end up in urgent care or emergency departments to get that care in a timely manner. Only 13% of ER visits here are generally admitted to the hospital. So 87% of those visits generally are for typical medical complaints like the flu, sore throat, headaches, rashes, influenza, that kind of stuff that probably could be treated by your primary provider, but it's just too difficult to get in or you don't have a provider. Patients pay on average of $650 per ER visit. And again, if 87% of those could have been handled in a in-clinic or out-clinic patient setting, that savings would be significant. But again, it's hard to get into providers. And an average ER wait time is about 4 hours. So again, it's not necessarily real convenient to sit there for a long time before you're seen as well. So there comes telehealth. Consumers continue to demand faster, affordable, cheaper, easier ways to access anything, not just healthcare. 100 million Americans own smartphones. So in the past, a lot of people would maybe push back at the idea of doing mobile health care. However, it's really a majority of Americans do own smartphones once they're of age. And then up to 80% of people actually use their phones for commerce and interaction with personal information. So it's not out of the question for people to begin sharing health information, payment information, and stuff from their phone anymore. We use phones for a lot of different applications in our life, so healthcare is probably going to be no different. As we can see, we use them for love and finding relationship matches, maybe scheduling car maintenance appointments, transportation opportunities for Lyft, Uber, maybe food delivery, communication, education. I always joke with my family, I feel like I have an app library for everything. Every organization wants their own app. You've got one for school alerts. Maybe you need to have tickets to a concert and you need to download in an app. You've got work announcements that come through apps and connections. So everything, it feels like, has an app. Here's one more. We do use the internet a lot to try to treat our own health. 10 million Americans search the internet every day for healthcare information. So we're always Googling to see, what's wrong with me, trying to find a solution. However, only 16% of our searches ever end up with satisfied information to help us. It's more so we're just trying to combine our searches to see if anything fits us close enough. There's really, before telehealth, there wasn't that personalized medical answer other than going to your local provider. So introduce Doctor on Demand. This is a mobile app, but also a web-based platform. So if you don't have a smartphone or you prefer not to use your phone, you can still do this with your computer through their website. Again, you're going to be connected with a board-certified medical professional, doctors, nurse practitioners, ARNPs, psychologists, therapists, counselors, all of the above. They're live and they're one-on-one chats with that provider. You do need to use video conferencing for the visit. Otherwise, insurance likely won't reimburse you for or cover that clinic visit. But as long as you've got your camera on for your phone or your computer, that's as easy as it has to be. You don't have any special software downloaded to your particular device. The nice thing about this is they're immediate. There's very minimal wait time. You get to generally pick which time you're available, which providers you want to see, makes it consistent and reliable. Again, convenient. You get to decide when and where, and it's cost effective, as we'll see in a little bit. What are some good reasons to use Doctor on Demand? Obviously, lots of just general conditions that could be handled telehealth wise. But there might be opportunities like, for say, this fall you get influenza really bad and it's just kicked your butt. You're stuck in bed on the couch and you just feel a little too sick to actually get in the car and drive downtown to the doctor's office. Telehealth would be a great option. You need some care, but it could be done from the comfort of your own home. Perhaps you're too far away. This is another thing I think people forget about with telehealth, but if you need a prescription refill, or again, you've got something going on, a sore throat or something, and you live 2 hours from your provider, or you're trying to see a counselor or a therapist and they're up in Mayo Clinic, and that's just too far away for the particular situation you're dealing with, telehealth could be a great option. There are also some people who live not necessarily in Sarasota County, but who live in healthcare deserts, so to speak. And so telehealth is a great opportunity for them to connect with healthcare professionals, even if it's just, the first appointment, and then that's deemed that they do need to be seen in person later. Great for people who are busy like myself, parents who are running from here to there, or maybe work unusual hours or different kinds of shifts, and the traditional clinic hours don't mesh with your schedule. These would be great opportunities as well to engage in telehealth clinic appointments. And then, of course, cut down on the wait time. Most of these appointments are 15 minutes. So you can literally do it during your work break or the lunch break, and not have to take the extra time for travel in between and stuff when your time is short. So how does Doctor on Demand work? They have a national pool of doctors that are available 24/7. So depending on what time you need, they'll show you which doctors are available at that time. They generally try to match it to your geographic area. So wherever you are, when you request that appointment, it will try to match you to someone in the area, in the vicinity. Like I said, they've got providers from all over the world. So depending on where you are, they might speak a different language or be associated with a different area of the country, and so to speak. You consult with that physician in person, like I said, with the video. You'll receive your diagnosis and additional treatment plans if that's necessary, if you need a prescription or anything like that. The nice thing is they do send the prescriptions to whatever pharmacy you prefer. So you just note that when you make your appointment, and if there's a prescription needed, all that's covered. So then you just drive to the store and pick it up after your appointment. The communication is secure. You don't have to worry about, like I said, having your own video conferencing system or anything. That's all handled on the Doctor on Demand side of things. You just got to make sure your camera is working with whatever device you're using. The doctors, the doctor on demand platform and stuff is all responsible for the liability, the standards of care, documentation, everything on their end. Nothing you need to do on your end. Again, you get to select the provider. They'll show you a listings of providers available at the times you specified or with your specialty of choice that you need to be seen for. And you can go through and read a little bit about their bios. There's a picture of them. You can see really an in-depth view of what doctor or medical professional you'll be seen by. And then you make payment right through the app as well, or the website. When you register, it'll ask you for your insurance information. So make sure you have your health insurance card with you when you first sign up. And then that way it can predict what you'll be paying for that particular visit. So I'm just going to show you a quick video of what the Doctor on Demand specific app looks like if you were to use it. So again, a pretty slick app that I think is definitely worth trying for certain situations. There's a couple other reasons we want to try to convince you to take advantage of Doctor on Demand or other telehealth opportunities. One, it's very hard to find or get into your provider in a timely manner these days just because of the shortage we're seeing. And so if you need to be seen relatively quickly to try to get better, telehealth can be a great opportunity. I'll give you an example myself. My kids had strep throat 1 week, and by Friday, I knew I was starting to get it myself. I couldn't call the provider. I couldn't get in that week, and it was going to be, I think, Wednesday of the next week before she had an opening. So being a Friday, I didn't really have many other options for other providers other than urgent care. And I knew what I had. I just knew I needed to get some antibiotics in me, and I prefer to start them sooner than later. So I did telehealth with Doctor on Demand. I got an appointment that afternoon still. I had my prescription within the hour after I had my visit, and I was already on antibiotics for the weekend. So that was just an example of a great way to use the service. And honestly, I don't think I actually had to pay anything for the clinic visit itself, the appointment visit, because Wellmark covered that, but I just paid for the prescription. So it was very convenient. Another thing that this will help do is free up those unnecessary visits to the urgent care or ER for things when we can't get into our providers. So saving that space for those who really are suffering from an urgent need, you know, broken bones or lacerations or other emergency care needs. And this is, again, like I said, a good way to save money, especially if you're on the high deductible plan, because a lot of times you have to pay that full amount until you meet your deductible if you're at in-clinic visits. And Doctor on Demand generally is cheaper than an in-clinic visit. Traditional clinic visits are run around $104 based on Mercy's cost estimator. Doctor on Demand visits are anywhere from, like it said, $49 to $79, depending on if your insurance covers it or not. Like I said, I'm pretty sure in my case, I did not end up paying for the actual visit because Wellmark was a covered benefit. I just paid for the prescription. I tried to get information on more of that, and I haven't got anything yet, but maybe Bob can hook us up with some connections if you do have questions about coverage. But I do recall that it does give you an estimate based on your insurance coverage when you enter your card, what your appointment you'll be responsible for. So estimated cost savings, again, I pulled these estimates from both the Mercy cost estimator and the Wellmark cost estimator on what things to expect. So if you're just using Doctor on Demand, if you're on the high deductible plan, you're going to probably pay a little bit more because you're not just having a deductible payment or a copay, excuse me. If you're on the traditional plan, it'll likely be a little bit cheaper, but no insurance at all, obviously, is still pretty affordable compared to an in-house visit. And then, of course, Virgin Care is significantly higher for these different plans. So a good opportunity to save some cash. And like that video showed, there are so many opportunities to take advantage of telehealth appointments, from allergies and acne all the way to UTIs and IBS and everything in between. Like I said, there's a whole separate wing for mental health, anxiety, depression, counseling, therapy sessions, psychologist visits. So there's lots to take advantage of with this platform and to get to providers conveniently and quickly. So how do I get it? I'm going to show you what the website looks like. This is Doctor on Demand. When you first come, you'll register. And again, it'll ask you for an email address, make a password for your account, and it'll ask you some personal information, your health insurance, so have your card handy. It'll ask you some background health history information. You're also able to add dependents into your own account. So like I could add my children or spouse or whatnot into the same Doctor on Demand account for my family. So that's convenient too. Then when it comes time to book an appointment, everyone can use the same app. You just click which patient it's going to be for. So that's nice. Not everyone needs their own particular account if they're a dependent onto your family. So once you're signing in, you'll get to a screen like this after you've entered all your personal information and you're actually ready to make an appointment. You can decide if it's medical based or mental health based. Like I said, the medical appointments are going to be immediate. You're going to either pick the time or the provider and however quickly you're wanting that appointment. Mental health appointments require at least a 24-hour notice of booking an appointment because, again, the psychologist or therapist, whoever you're working with, is going to need time to assess an intake form and review additional information. So you can, like I said, schedule by appointment. You can schedule out in advance. So maybe this is just like a prescription refill for something and you need a doctor's clinic visit for that. You could schedule this, next Friday at noon or whatnot, if that was a time you had available for a prescription refill consult. So it doesn't have to be immediate. If you don't need it immediate, you can certainly schedule these as well weeks ahead of time. So pretty simple. Another thing I'll show you is, if you guys aren't familiar, Wellmark, our insurance carrier, does offer a program called My Wellmark, and this allows you to create your own account with Wellmark to view your statements and everything like that. So if you don't have that already, sign up for it. But the nice thing about it is it has a bunch of insights into the different benefits that are associated with our coverage, so you can see what you might be eligible for. The other thing is it does have some cost estimates, and so you can see like what Doctor on Demand and other kinds of things might be covered by the insurance program you're enrolled in. You can also do cost estimates and that kind of stuff here. So if you weren't familiar with My Wellmark, that's another great website that's personal to what you've been using expenditure-wise for the program. So that is Doctor on Demand. And if you have any questions, please let me know, but you can put them in the chat. Betty will jot them down. If you want to vocalize them now, I'm sure she'd take opportunity to write them down as well if she can't answer them. But like I said, Bob with the auditor's office would be another great connection to get with, and he can get you to the right places for the right answers with Doctor on Demand or other telehealth apps that might be of interest. So hope if you weren't familiar with it, you are now, and find a little bit more comfort in using it, and will take advantage of it and keep some money in your pocket. Thank you guys.